You're supervising a medical student and take them with you to see a patient. On introducing themselves to the patient, you notice that they only say their name and do not mention that they are a medical student. When you have finished, the patient thanks your student, saying, "Thank you, doctor," and the medical student does not correct them. Rank and order the following actions in response to this situation. 1 equals most appropriate. 5 equals least appropriate. A. Ask the student to return to the patient and explain that they are not a qualified doctor. B. Discuss with the student how they need to fully inform the patient about who they are. C. Go back yourself and explain that you're the doctor overseeing the medical student and will be organizing their tests. D. Leave the matter. You're supervising the medical student fully anyway. E. Stop the medical student from seeing any further patients. Answer: A, B, C, E, D. Despite not being part of a registered body, medical students still have to follow the same rules as doctors. There is specific guidance for medical students from the General Medical Council (GMC) about personal conduct. Therefore, the most appropriate thing to do is to ask the medical student to go back and fully inform the patient. A. The medical student needs reminding that they have a role in patient care and protecting patients, a big part of which involves being truthful with the patient. B. The third best option here is to discuss the matter with the patient yourself. C. Although it would be better for the student to do this themselves. The two worst options are E and D, to leave the patient thinking that they have been seen by a doctor when they have not, is completely inappropriate. D. Making option E the better response than D, in which you do nothing. You're working on a care of the elderly ward, and one day, you overhear the senior house officer, SHO, telling a patient how they have pulled some strings with a radiologist to make their computed tomography, CT, scan a priority. Later, you see the SHO accept some money from the patient's husband for all he has done for them. Choose the 3 most appropriate actions to take in this situation. A. Advise the SHO to refuse gift from patients in the future to prevent him from looking like he is doing things for the wrong reason. B. Discuss the matter with your education supervisor. C. Discuss the SHO with the nursing staff. D. Recommend to the SHO that he donates the money to charity. E. Report the SHO to the General Medical Council (GMC). F. Tell the patient that she has had the normal standard of care and that doctors should not be accepting bonuses from patients. G. Tell your consultant that your SHO is accepting money from patients. H. Try and use the same technique on your patients. Answer: A, B, G. Accepting gifts from patients is an ethical gray area, and different people have differing opinions. However, it is agreed that you should not accept gifts in the form of money. Certainly, in this scenario, it sounds as though the SHO is coercing patients a little by making it sound as if he is doing more than he actually is to influence patient care. Option A is correct because you should talk to the SHO in question and try and advise him otherwise. Talking to your supervisor, B, is also sensible as getting advice from someone with more experience is helpful. Telling the consultant who is in charge of the patient's care, G, is also important. Discussing it with the nurses is tantamount to gossiping and is therefore best avoided. C. Giving the money to charity is, of course, a good moral option. D, but it does not address the root of the problem. Immediately reporting the SHO to the GMC prior to talking to them, E, is also not recommended. Talking directly to the patient will leave them distrustful of the health service and will also make them feel bad about trying to give a gift. F. Obviously, trying similar methods to receive gifts from your patients is not appropriate. H.